One of the most surprising and underappreciated truths about liver health is that a person can develop fatty liver disease without being overweight. This condition, known as lean NAFLD, non-alcoholic fatty liver disease in individuals with normal body weight, challenges the common belief that fatty liver is only a concern for those who are obese. In reality, the liver's vulnerability is not limited to body size. It is deeply influenced by the quality of one's diet, exposure to toxins, stress, sleep patterns, and even genetics. As a result, many people who appear outwardly healthy may be silently harboring fat accumulation in their liver, with no visible signs and often no symptoms. The liver does not need to enlarge to accumulate fat. Hepatocytes, the primary liver cells, can become packed with microscopic droplets of triglycerides even in a liver that appears normal in size and structure on a physical exam. For lean individuals, this condition is often overlooked because their outward appearance does not match the usual clinical picture. Doctors may focus on more obvious risk factors like BMI or waist circumference, unintentionally dismissing liver concerns in a patient who is not visibly overweight. This makes lean NAFLD especially dangerous, not because it progresses faster, but because it is frequently missed until more advanced stages. Lean NAFLD is not rare. It accounts for a significant proportion of fatty liver diagnoses in Asian populations and is increasingly recognized in the West as well. Studies suggest that lean individuals with fatty liver may have more metabolic abnormalities than previously thought: elevated liver enzymes, insulin resistance, or altered lipid profiles, even if their weight and cholesterol appear normal. What this reveals is that metabolic health and body weight are not always aligned. A person can have a normal BMI but still carry visceral fat around their organs, particularly the liver, which puts them at risk for inflammation, fibrosis, and eventually non-alcoholic steatohepatitis, NASH, or cirrhosis. Several factors contribute to lean NAFLD. Poor dietary choices, especially high intake of sugar, refined carbohydrates, or industrial seed oils, can drive liver fat storage even in the absence of excess calories. Fructose, in particular, is a potent inducer of de novo lipogenesis, the process by which the liver converts sugar into fat. A high fructose diet from sodas, energy drinks, or processed foods can burden the liver over time, leading to fat buildup independent of weight gain. Chronic stress and poor sleep elevate cortisol and insulin, further encouraging fat storage in the liver. Environmental toxins like BPA, pesticides, or certain medications can also disrupt liver metabolism, silently promoting fat accumulation in people with otherwise healthy lifestyles. Because lean NAFLD presents few symptoms, perhaps just fatigue, bloating, or vague digestive discomfort, it rarely prompts investigation. Routine blood work may show mildly elevated liver enzymes, but these are often brushed off or attributed to other causes. Imaging studies like ultrasound or transient elastography, FibroScan, can reveal fat content or early fibrosis, but they are not routinely ordered in normal weight patients. As a result, many lean individuals live for years with undiagnosed fatty liver, only discovering it when more serious problems like prediabetes, hormonal imbalance, or unexplained fatigue arise. This underlines the importance of a more nuanced and preventive approach to liver health. Rather than using weight alone as a marker, physicians and patients alike should consider screening for fatty liver when other risk factors are present: family history of metabolic disease, elevated fasting insulin, triglyceride imbalance, PCOS, chronic fatigue, or high sugar intake. A simple liver enzyme panel, ALT, AST, GGT, when combined with imaging and metabolic markers, can offer early insight, long before damage becomes irreversible. The good news is that fatty liver, including lean NAFLD, is highly responsive to lifestyle change. Reducing added sugars, especially fructose, is one of the most powerful interventions. Emphasizing whole, unprocessed foods, rich in antioxidants, fiber, and healthy fats, supports liver detoxification and reduces oxidative stress. Intermittent fasting or time-restricted eating may enhance fat mobilization from the liver. Moderate physical activity, even in those who are not overweight, improves insulin sensitivity and helps clear liver fat. Nutrients like choline, magnesium, taurine, and B vitamins further support liver metabolism and mitochondrial function. Ultimately, lean NAFLD reminds us of a deeper truth: health is not what you look like, it's how your body functions. A person with a healthy weight but a sluggish liver is still at risk for fatigue, insulin resistance, and long-term organ damage. But the liver is also remarkably forgiving. Given the right tools, real food, movement, rest, and care, it can shed fat, reverse inflammation, and regenerate. Even when silent, it's never too late to listen.